Well, it's very difficult to summarize such a broad topic, but I think what came through very clearly to me was that we do need to have as many people involved as possible. We shouldn't prescribe precisely who is a legitimate actor in this discussion, and that you need to tackle it not just in very specific vertical ways. You can't say treatment versus prevention. It's, as Mark said, you need to try and work to end all epidemics. You can't simply say that you have a disease-driven approach either if there are no systems that underlie that to help all of the great ideas and systems get from their small-scale successes that we've been hearing about in all of these different pilots, or the very big-scale successes when it comes to specific conditions, as we've seen with malaria, as we are seeing more and more with HIV/AIDS. You obviously cannot separate from the issue of health literacy, from the issue of education, from the issue of having technologies that allow people to communicate. That really connects into that idea that we heard that health problems are not just a result of medical issues, they also have societal factors as well. I think that it was very clear that you cannot argue that a health outcome will be achieved unless you involve the community in designing the response to that health problem. That means that you also have to reflect that community, and one of the very clear messages that came through was the issue of having a gender-equal world and having women in particular involved in designing those systems. We were very privileged to have a young leader on the stage with us today, and that's highly relevant in a continent like Africa with the youth bulge coming up. If you're not including the voices of those people who are going to use the system, drive the change to get us to that sustainable healthcare by all, it might also not work. I think that I heard very clearly as well that inequality is a growing problem. Wealth gives you the resources to tackle the problems, but if there is a more unequal world, it's a lot harder to get to that last mile. It's a lot harder to make sure you get to the for all part of the Sustainable Development Goal that we've all been discussing. 77% of you said that the for all part was going to be much harder than finding things that were sustainable or getting those things delivered by 2030. I think that I'm going to wrap it up there. One of the questions and thoughts that came in on Twitter that really stuck with me is that this requires a huge dose of political will. I think that's true. I think we have a lot of the technical and medical solutions out there. They work in the developed world right now. If we can just figure out how to work more with each other and to scale up and spread out some of those great ideas we've been hearing from panelists on the stage, then we're going to get much closer to that goal of sustainable healthcare for all by 2030. Thank you all for your participation, and I'll invite our panelists to stay on stage for a second to take a photo. And thank you very much, everybody.